Well, everybody, right now I'd like to introduce you to two people. And the first person I'd like to introduce you is Dr. Bruce Wang, and alongside of him is Mary, a patient. And we're going to talk about rare blood diseases, and especially a blood disease called AHP. Okay, and will you tell us about this, Dr. Wang, and who it affects and what the symptoms are?
Sure. So the acute hepatic porphyrias are a group of 4 genetic disorders that are all rare. They primarily affect women during their reproductive years, and it presents with severe, potentially life-threatening, episodic neurologic attacks. The main symptoms that people get are severe generalized abdominal pain, but patients can also develop weakness, numbness, fatigue, and even mental status changes during acute attacks.
Okay, now is this inherited, or is it a genetic blood disease, or does it just happen in young people, old age, not old people, but at different times of one's life?
Right. So it is a genetic inherited disorder. So patients with acute hepatic porphyrias are born with the disease and have inherited mutations from their parents. But typically, acute attacks are triggered, in addition to having the mutation, by other inciting events, most commonly taking a new medication that could trigger an acute attack. And it primarily affects women. 9 out of 10 patients who have acute attacks are women, and primarily during their reproductive years, so from their teenage years into their late 40s and 50s.
Okay, now, do people, you know, like what type of doctor, you know, if you have these symptoms or your doctor says you have this acute hepatic I can't pronounce the name. It's really a toughie.
It is, and because it's a rare disease, most physicians don't think about it, which is one of the main reasons why it's such an underdiagnosed disease. And the other reason why it's difficult to diagnose disease is because the signs and symptoms of acute attacks are not specific to the porphyrias. And it could look like many other more common disorders, which is the second reason why this disease is oftentimes undiagnosed.
Okay, now Mary, you have this condition, and how long have you had it, and what are you going through right now?
Now for 22 years, and I was perfectly healthy before I triggered the disease, which was from a sulfonamide antibiotic. I went for about 6 years when my hormones were at their peak, having attacks every single month. Since that time, I've gone chronic. So I have what one doctor called a grumbling low-grade porphyria. So every day I feel like I have the flu. Body pain, abdominal pain, nausea, no hunger, and weakness.
Okay, every day?
Every day, yes. I'm on disability from the disease.
Okay, now I have a question. I mean, Dr. Wang, are researchers looking into it? How could someone have quality of life if Mary's in pain every day of her life? It's almost like having fibromyalgia.
That's correct. In our most severe patients, such as Mary, it could be a severely debilitating disease and patients could have no quality of life when their disease is that severe.
Okay, now Mary, you can walk, can't you?
I can walk. I have had an episode where I was fully paralyzed, but within 6 months I went through a wheelchair to a walker to walking again. I do have paralysis in my hands. They're very weak. Like I can't do the hitchhiker sign.
Well, we don't want you hitchhiking.
Hitchhiking. So yeah, it can lead to paralysis. In many cases, the paralysis can improve, but in some cases, it does become permanent.
Okay, but did you go through your daily activities? I mean, you've got to cook, you've got to eat. I mean, do you go through this?
It takes a lot of physical and occupational therapy. Different things like to brush my hair and brush my teeth, I do it two-handed. Anything downward I can do, like I can pull weeds or lift things. It's just kind of the upward with the wrist where I have problems because the nerve that was affected.
Okay, now how did you know you had this? Like you were getting these pains and you went to your doctor?
I didn't know I had it until I was 28 and took a sulfonamide antibiotic. After 4 or 5 days, my stomach pain was out of control, abdominal pain, sorry, very generalized pain, and I passed out. And so I was brought into ER. Over the next 18 months, I had 12 more attacks. In most cases, went to the ER, ended up admitted to the hospital. And they ran every test you can imagine, MRIs, CAT scans, every blood and urine test, and everything came out negative, and I looked like a perfectly healthy person, but I had this out of control pain. So I had a few misdiagnoses before finally having a doctor think porphyria and do the proper test.
Okay, now Dr. Wang, did you find out by a blood test? How, you know, like there might be somebody watching right now saying, oh my goodness, I have so much pain, I'm in pain, I may have this. I mean, what is the test to find out?
That's correct. There's actually a simple and very accurate test. It's a urine test that is very specific for the porphyrias. And we can confirm the diagnosis with genetic testing to identify the mutations.
Okay, so somebody would go to their doctor and say, I want a urine test. Please take a urine test for the APF disease.
Like porphyria.
Right.
That's correct. That's correct.
Okay. Wow. Wow. But 22 years Mary has been like this. I mean, I've got to give you credit. I mean, you look fabulous.
Thank you. Thank you. It's hard to deal with this disease, but getting up this morning to get the word out there and inform patients and doctors, you know, is just so important to me that's why I'm here today to talk with you.
Well, we thank you. I mean, and Dr. Wang, thank you. But where can people go get more information? If one of the viewers in Alabama is watching right now and they're saying, hey, you know, I think my father has this, or I think my mother's been complaining about this, where can they go for help?
Yeah, so patients can go to the American Porphyria Foundation's website at porphyriafoundation.com, as well as the Alnylam company's website, alnylampact.com. And also for patients in Alabama, the University of Alabama at Birmingham has a Porphyria Center in their hepatology group. And Dr. Joseph Bloomer and Dr. Ashwani Singhal are both well-known Porphyria experts.
Oh, that's wonderful. Thank you so much. I mean, you know, we never know who we may touch here with this interview, and somebody could, you know, get on the road to at least more quality of life than they have right now.
That's right. We hope so.
Well, thank you so much for being with us today. And continue this outreach, Mary. You're doing a great job.
Great. Thank you, Suzie.
Bye-bye. Wow, everybody. I mean, oh, wow. I mean, you just never know. I mean, that lady, Mary, could be sitting next to you at a pizza place, or while you're at a restaurant, or next to you at a football game, and you would never know what she was going through in that constant pain and not able to use her hands to the best ability. Wow. But again, everybody, it's APF, and I know it's a very hard word to say, porphyria, and it's spelled P-O-R-P-H-Y. It's acute hepatic, and that's H-E-P-A-T-I-C, porphyria. Wow. Okay, and of course our interview was brought to us by Alnylam. All right, we're going to take a break and we'll be right back.